what is Ozempic face? Is that something that you've been reading about or hearing about and you just want to know? Wegovy face, Mounjaro face, what are these things that people are talking about? I'm Dr. Lynn Neiman. I'm a board certified anesthesiologist and aesthetic medical provider in Winchester, Virginia, in my practice, Blossom Medical. I am really excited to actually talk to you and have a discussion about semaglutide face, Ozempic face today in a way that maybe people haven't talked about quite before, and then to talk about ways that we can use our tools in our toolbox to help with facial restoration. If you think that this content is valuable to you, I would surely appreciate it if you would like and subscribe below, and let's get into the talk. I actually have an issue with the discussion around Ozempic face for one reason. I find just in general, I will say, I love that we have tools to help people lose weight, feel great about themselves, whether it is a little bit of weight, whether it is a lot of weight, whether it is specifically for health reasons, whether it helps your psychological well-being, whether or not it helps your lungs, heart, kidneys, it helps you exercise more. There are so many positives. It can lower your risk for diabetes, can lower your risk for cardiovascular diseases. But just the choice to go on any GLP-1 agonist, so Wegovy, Mounjaro, Ozempic, any of that, it is so personal that I feel like calling out celebrities, calling out people for having Ozempic face is a way for people to pass judgment on another person's medical care. I'm a medical provider. I'm not your medical provider. I'm not their medical provider. I cannot understand the decisions that somebody else goes through to make a really personal, informed, and educated decision to go on a medication to help them either with any of those medical conditions that we talked about, or just to feel and look better, whether or not that's for other underlying wellness with risks of other systemic diseases like diabetes, high blood pressure, heart disease, or whether or not it's just really truly something that just helps with wellness, with exercise. That is a very, very personal decision. And so I feel like we as a group of people talking about us, like maybe a celebrity or someone's Ozempic face, it makes me in the pit of my stomach feel uncomfortable, because I feel like we like to look at people and go, oh, they did this thing, or they cheated, or they used this method, or they, did something one way or the other. And I feel like it's a way of us to pass judgment on somebody else. So let me just say this. If you are a person who has had weight loss for any reason, whether you have changed your fitness, whether you're on a medication, whether you have had a bariatric surgery, anything else, your face is going to change. And likewise, if you gain weight, your face is going to change. But sometimes you reach a point as a patient when you look in the mirror, you might feel like, I just don't look like myself, or there's something I feel uncomfortable about. I want you to know, so I'm talking to you, I want you to know that an aesthetic medical practice is a safe place, and I can speak for myself. My practice is a safe place where you can come in and talk to me about when you feel like there's a mismatch between what you see when you look in the mirror and what you feel like on the inside. And we can talk about things that we can do to really use our tools in our toolbox effectively to help you really have that outside match that inside. Because overall, I think that that kind of wellness and wholeness that you feel is going to help you reach your health goals overall, and to just help you go out and do amazing things in your life. So let's talk about just if you've had some weight loss or significant weight loss, and you might be seeing some changes, things that are happening to the face or the skin that we can help with. Number one is, if you've had volume loss, there are two things that I would have you consider. One is potentially considering some hyaluronic acid fillers to add some volume back to the fat pads of the face, but I would do that when you're close to your goal weight. And the reason why is you do not want to end up with an overfilled face from making large tweaks to that volume as you're still reaching your goal weight. So slow and steady is the name of the game with anyone who's had some weight loss, and we can absolutely 100% add some volume with some hyaluronic acid filler. But again, slow and steady there. The other thing is just doing things to support your collagen and skin tightening. And from an aesthetic medicine standpoint, doing things like radiofrequency microneedling and soft wave, which is high frequency ultrasound, those things can help build collagen and tighten the tissue. And so those are things you can discuss with your provider. Again, I am a provider, but not your provider. So you can discuss ways that you can effectively help to tighten the skin and give yourself that beautiful canvas of skin that you deserve. Sometimes with significant weight loss, it is really in your best interest to talk to a plastic surgeon. You may need to talk to someone who can do a surgical intervention to get you the result that you deserve, and that will give you the best, most beautiful, and long-lasting result. So those are just 3 of the things, of the kind of tools in our toolbox that we can use to help you if you've had significant volume loss in the face. But again, I really want to be clear to say, we need to have a gentle heart when we talk to and look at other people. And I love to celebrate someone's success. And so if someone has had a weight loss that they feel great about, I really don't care how they got there. I'm going to celebrate that, and I'm going to help them look and feel their best going forward, no matter what. And so I hope that this inspires you to maybe dial down your judgment a little bit and to really support your friends near and far, and even just admire celebrities or people in the media who tell you that they have maybe used a GLP-1 agonist in order to help them meet their health goals, because that really does take a lot of bravery. And we should really celebrate that and really thank people for not gatekeeping as well. So that's my take on Ozempic face, and I hope that that was really helpful for you. And I would certainly, absolutely, if you have been struggling with some volume loss or been struggling with seeing something in the mirror that doesn't feel like it matches on the inside, I would be happy to see you in consultation to discuss a really comprehensive plan to really get you looking and feeling your best and most confident self. And if you are in the Winchester, Virginia or Northern Virginia area, I would happily see you in person. But if you are not nationwide, we do offer skincare consultations, and we can chat with you about anything that would help you really improve the look and quality and confidence you have in your skin. But again, be proud of yourself, love yourself from the inside. Most importantly, we'll help you with the outside in any way that we can, but you are beautiful, and remember that from here on out, nobody deserves to pass any judgment. So keep it to yourself, love your friends, and that's all that I have to say about that. Like and subscribe if this is helpful information for you, and share with a friend.